Are we on? Can you hear me?
Can you hear me? Microphone check. Lights. Cameras.
This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
Us to 19 minutes past 9 this morning here on Culture Daily. Before we jump into the conversation real quickly, let me tell you about looking forward to a British degree at a fraction of the costs in a vibrant student experience. With a vibrant student experience in a community that would equip you with youthful employability skills, taking you a step closer to the career of your dreams. Make it happen at Lancaster University, Ghana, where you get up to 50% plus on scholarship if you're offering a degree program at Lancaster. Be taught by the finest faculty of trained professionals to UK standards in the ultra-modern campus. For more information, just go to lancaster.edu.gh, or you can email them admissions@lancaster.edu.gh or call 0209 60 70 08. Lancaster is the only British university campus in West Africa. And also Betway is reminding you once again that there's a once-in-a-lifetime play on the pitch experience for you at the Emirates Stadium. If you haven't heard, only if you bet on Arsenal, bet on Arsenal. Why is this so? Because now Betway is the official betting partner for Arsenal, and with this you can get way more on their fan exclusive page. It's very simple. Just jump onto their website and you can make this happen for yourself. You can win jerseys as well as memorabilia and more if you play the game. It ends on the 31st of January in 2025, exclusive to Betway. Terms and conditions apply. Betway is regulated by the Gaming Commission of Ghana, no under 18. Betway gets way more. And don't forget, brush your teeth morning and evening with Pepsodent Cavity Fighter. It's fortified with pro-fluoride and micro-calcium ingredients that will help seal tiny and invincible holes in your teeth. Comes in various pack sizes. Comes in the 120, it comes to 175, it comes in 65 gram, and the 12 gram sachet as well. And it means you can always afford any of them at any point in time. Don't just brush your teeth morning and night with Pepsodent. It will make your gums, it will protect your gums and make your teeth 10 times stronger as well. Well, this morning we're going to talk about HIV/AIDS, but prior to that, we're doing a quick part two on our conversation with regards to fertility. And we've a lot of young women want to give birth and have beautiful babies and all as well, and a lot of boys out there also want to become fathers, responsible fathers. So we can celebrate Father's Day better and Mother's Day better. I don't know why Cyril is laughing and smiling as such, but
the fatherhood, and you assume that all mothers are good.
Yeah, I know we'll go into that. When I said responsible fathers, and you wanted responsible mothers as well.
I agree with you.
Yes. I agree with you too, my brother. Yes. So we want responsible mothers and responsible fathers.
Yeah.
Yes. We want responsible fathers such as Cyril himself.
Highly responsible.
Yeah, who takes upon himself when you call him, I'm bathing my children, I'm bathing them, wait, let me finish. Yes.
Thank you.
Yeah, but we're going to go back to the making of these children by Cyril.
Yes.
He's our main.
No, I can show you. It's not that. It's actually nice.
Midwife, I
just in shock.
I got shocked. You're like,
I just in shock. She was like,
She just kept looking at Cyril.
Yes.
He's in shock. Don't worry. I'm not wearing my glasses here.
You can show us how you
Oh, yes, we have the diagram. Put the diagram
on the screen and they show the viewers how it was done. Yes. We understand that we don't have much time, so we'll go into it and then we'll dovetail into HIV/AIDS as well. We do understand that the act of making producing a human being is a very sacred, solemn practice that is reserved for responsible adults. However, young people have also decided to take up this mantle and champion it sometimes wrongfully. Childbirth is not reserved for either kids or adults. If it happens, it has happened, and you have to prepare for it one way or the other. But we want to understand the process. We want to talk about how a woman can prepare her womb, as she's living, to prepare herself for to give birth, and how a man can also practice how a man can also prepare himself I know when I said practice, then then you want to remove my my esophagus.
You
my
see, as I not talk, I didn't say anything. No.
But we know there's just like how we keep saying that for somebody who wants to travel, you need to prepare your statement and all that. I'm sure there's a process. There are things to take into consideration from habits, for the both men and the woman. But let's start off with the woman at first, because that's the career of the of the baby. So let's go into that. So good morning, please. Yeah, and welcome. Where do we start from? I want to give birth. I'm a woman, an 18-year-old. I'm an adult. I want to have a child.
Okay, good morning.
Ayeka.
Good morning.
So to start with,
Yes.
pregnancy, it's a process. Okay, before you can get pregnant, you go through a process. There are things you should consider if you would want to get pregnant. I would want to share. There are lots of things, but
Yes,
maybe I can share about 7 things with us.
Yes, that's enough.
So let me start with the first, which is a mental preparation. You need to be psychologically ready to have a child. Lots of people, last week we talked about abortions. Some people, maybe they've done an abortion before, so they think, okay, maybe that's why I'm not getting pregnant again. And before we even continue, I would want us to, Chris.
Yeah.
Maybe. So I would want us
Hey,
to
why
talk
you've
about.
done something with Chris?
No.
Trying to say before I continue,
Before we
Chris.
continue, we want to put something out there.
Okay,
So
okay.
concerning the conversation we had last week, I remember Chris talked about how that the law said something about abortion, and fortunately, I've been able to get the law, so I know what the law says.
Okay,
about
let's
abortion.
read that out.
I'll
Yes.
be glad if we could read that
Yes,
out.
yes.
So
We sent it to them. So we
I
can
sent
put
it to them.
tomorrow.
Maybe they could.
Oh, okay. So whilst we
Project
get them to put it on the screen, maybe we can just start.
Okay, so the mental preparation.
Okay.
You should be psychologically ready to.
Okay,
have
I'm
a
told.
baby.
Sorry to catch. I'm told it's ready now, so we can
Yes,
put it
please.
on the screen, and then we can see what the law says about this. I can help read that out. So it says the Ghana abortion is governed by the Criminal Offences Act 1960 Act 29, specifically under sections 58 and 50 and 67, as amended by PNDC Law 102 in 1985. Hey, Bibrio. Section 58 something 1 of the Criminal Offences Act states that it is generally unlawful to procure an abortion. However, Section 58(2) outlines the conditions under which abortion is legally permitted, including risk to the life or health of the mother, severe fetal impairments, and pregnancies resulting from rape, incest, defilement, or of any mentally disabled woman. It goes on to say, PNDC Law 102 something further clarifies and expands the legal grounds for abortion, specifying that the procedure must be conducted by a qualified medical professional. Oh, you are?
Thank you for reading that out. So let's just continue with our conversation.
Yes.
So the first thing is be psychologically ready. Okay, prepare mentally. Don't
Not
judge
to cut you,
yourself.
but what do you mean by mentally?
So let me just I'm going to
have questions
explain.
about that. Yes.
Mental preparation is very important. Like, be ready. Don't be afraid. Don't think maybe I've had a previous abortion before, so I can't get pregnant. Some people think maybe God is punishing me, maybe God is annoyed with me. Like, it's mental prepreparation.
Yes, I get you.
You should just be relaxed. Like, so that's my first preparation for the female.
Okay, but what if it happens out of a mistake, and all those things?
The pregnancy happens.
Yes.
So still accept it. It's still
Okay.
accept
Okay.
it mentally. Like, accept that, okay, I'll be a mother. It starts from acceptance. Just accept it that now I'm pregnant and I'm ready to. I've done what adults are supposed to, or pregnant people, married people are supposed to do, and I'm ready for the consequence. Like, I'm ready to be a mother. Mentally accept the pregnancy.
That makes sense.
That makes sense.
Blue
right?
tick.
Okay, so the second thing is have regular unprotected sex. Regular unprotected sex is any sex. Regular
If you want to
if
get
you want to get
pregnant,
pregnant,
have regular unprotected
Unprotected
sex.
sex.
No, please
Yes.
let me clarify that. Let me clear that. Have regular unprotected sex
With
vaginal sex.
yes,
Penile
like which,
vaginal sex. You have to be. You have to clarify that.
Okay.
Because these days
Okay.
you have to be
we
sure
get
what you're
it,
talking about.
we
Yeah.
get
So
it.
our definition has changed in medical. Medical used to be that. That was the definition.
So
Right?
partners need to allow their male partners to constantly be in them
For a year.
consistently
For a year.
for the purposes of making a child.
Yes.
Yes.
Vaginal.
Are you
Say
listening?
it well. You have to
Are
add
you
it.
listening?
It's penile-vaginal.
Oh, I'm just mentioning that.
Are you people listening to Jay?
Okay.
It's
Asking
penile-
me if I'm listening.
It's penile-vaginal.
No
please.
restrictions. This goes out to the ladies there who've been restricting your man on grounds of and this, and I want my destiny to be this and all of those things. You have to constantly allow your man to have his way. Please continue. It's boring me.
Is this personal?
Is it?
It's personal.
Honestly, like
No, I'm on behalf of
Somebody.
I'm getting messages here.
the
That's what
person
I'm
you're talking to has heard you. Okay.
You have
Don't
to
worry.
allow constant. Please go. That point is very important.
Regular.
Regular.
Unprotected sex.
Regular unprotected sex.
Yes.
Yes.
Without any contraceptives. Okay, don't do any emergency contraceptives, don't do condoms. So a regular unprotected sex is sex that's happening every 2 days or every other day.
Hi.
If possible. If you can do it every day. If you can.
That's MTN bundle.
Do it out of love for your partner. You know, most people do it. You know, when you get to that stage that you want to have a baby, people do it like, I want to have a baby. But do it out of love for your partner. That's the caveat. Like, do it out of love for your partner every 2 or every other day.
Can the pressure from I want to have a baby be a hindrance to the performance?
Yeah.
and
Because
the
you are not
indicated result?
psychologically ready. Like, you are just anxious. Anxiety will not help you. You know, as women, everything in our body is regulated by hormones. And you even...
I'm
Nelly,
listening, Ajo. Yes, Ajo.
you realize that sometimes your menses can even delay because of
You're stressed.
yes,
Yeah.
how stressed you are.
Or
If
come
you're worried
earlier
about
than regularly.
Yeah.
Usually
you can
does.
get tense, then you just
Women,
start
you can come earlier
menstruating.
than because you are stressed.
Yes.
Like that.
Yeah,
Yes, and
so-
men too.
Yeah, you can
and
come
men too.
earlier.
We can because sometimes
Performance will be
performance
reduced.
is reduced or increased due to what the
When you have a lot of side chicks asking for money from you.
No, that
you
one.
can't continue.
No, that one we
No,
can
that's
provide.
not the one.
That one we can provide. Does not affect it in any way. Yes, but what the men are saying is that
Why
sometimes
Lenny root for you?
I don't know. Why.
He roots for me or me I root for him.
You know, but it's a great pointer you've expressed and you've shared. We would come to the men's side shortly,
Yeah,
but as you're saying, yeah. So you know, you mentioned
Mentally.
mentally. You've mentioned the
Regular-
frequency.
Regularly.
Yes.
sex. So for females, you can start taking folic acid. So folic acid helps improve your fertility. It helps improve your blood levels, and it helps prevent something we call neural tube defects in your baby.
Okay.
So basically, what happens is that most of the times, I hear people say, midwife, so can't we get this folic acid from food? We get something we call folate from foods. Like when you eat foods that are rich in iron, some of them give you folate, which is like folic acid, the folic acid you take. However, because you want to get pregnant and you will need more, your blood levels have to be improved to be able to accommodate another human or other, like if it's 2 or 3. So you need to have, or you need to boost your blood levels. So folic acid helps to do that. The neural tube defect basically is your neural tubes are your brain and your spinal cord. The people who have reduced folic acid or folate in their body end up having babies who have something we call spinal bifida. I wish we could get a picture and display on the screen for them to see. And if you have this if your baby has the spinal bifida, they have to go through a surgery to correct it, which is a neuro procedure. So it will be a neurosurgeon who has to do this, and it's cost effective. So you need to start taking folic acid so that you could prevent that.
So for the folic acid as well, can someone be taking folic acid just, on a daily basis or regularly without the intention of getting pregnant? Is that also a possibility?
Yes,
Or it's only
please.
for
You can
pregnancy?
take folic acid if you don't have intentions of getting pregnant. However, everything has advantages and disadvantages.
Yeah.
I've nursed people who have cancers and we don't give them folic acid because folic acid has a property of, it's able to multiply cells. So it's able to help the cancer cells to multiply faster. So if you are having maybe your family has a history of cancer, that's why I'm saying you are doing this if you are preparing for pregnancy or you are planning pregnancy. Assuming you want to get pregnant in the next 3 months, you can start taking folic acid. In the next 4 months, you can start taking folic acid. However, unless it's prescribed for you at the hospital, that's when you can do it like forever. People folic acid. However, for purposes of planning pregnancy, you should do it 3 months or 4 months to the time you would want to get pregnant, basically.
All right. Okay. Wow, that's interesting. Okay, so that might be the third point.
Yes.
So we've mentioned the frequency, mental, preparedness, and then now the medication that you can take as well. Let's go on.
Yes. So the next thing is you should work on any health issue you have. If you're having any disease condition, you're having any gynecological condition, you should work on them. There are people who are not menstruating and they want to get pregnant. Every woman has to menstruate. You should menstruate. If you're not menstruating, like, how will you get pregnant? Because your menses, so if you are menstruating, it means you are ovulating.
Okay, we have the spinal
bivida picture.
Bivida. Okay. I was going to mention something else. Let's put that. Let's put bivida on the screen now, as you've said. Okay, so just explain to us again. Is that what's that protrusion there?
It's the spinal cord that wasn't formed, or it's just a neural tube defect. It's a defect.
Okay.
As a result of folic acid deficiency. Yes, please.
So ideally, this yellow you're seeing, this spinal cord you're seeing that goes out, the bone and the skin should have covered that part.
Yes.
Your back.
So that will close up.
To close up and to go that pathway. So the pathway has changed.
So now it needs a surgery.
So it needs a surgery to repair that.
Oh, okay. Wow, I can imagine
Which
how
all this would have been folic acid would have solved this.
Would have solved this.
If the woman,
the mother was taking folic acid, would have solved.
But the man can't take folic. We'll come to the men. You hold on. We'll come to the men. Okay, so I just lost my chain of thoughts there. Okay, so you're talking about
working on any health condition.
Yes, conditions. Now we can just touch lightly on this example, HIV, as a condition and how that's. Can HIV be transferred to the baby?
Okay, so if the mother is on antiretroviral medications, the mother, so during pregnancy, you are taking your medications. When you are, it's time for you to deliver, we give them the options. You could have vaginal deliveries. You could have a cesarean section. It's not compulsory you do cesarean section.
Okay.
But after the procedure, your baby has to be given the antiretroviral medication. You are also supposed to continue, and you need to do exclusive breastfeeding. You don't do mixed feeding.
Okay.
Your baby will be tested after 6 weeks to see if the baby had it. And most of the time, some babies, if the mother is very diligent in the medications and the one she is taking and the one she's giving the baby, it's able to protect the baby from having it. But sometimes they are not able to be that diligent with it. Sometimes, during the process, there could be some issues that could make the baby get into contact with the infection.
Okay.
So we advise that, and it's so some way. Some people in their first trimester of pregnancy, they do it. So when you are pregnant, we do pregnancy test for you about HIV test for you about 3 times. The first 3 months when we do, they are negative. When they come again and we do, they become positive. Because the incubation period of the disease, of HIV, is about 3 months. So the person might contract it now and might not show any sign. It might not be seen in the during the procedure, like when they take the blood sample. So when that's why we do the test about 3 times before you give birth, so that we can give you medications and give your baby medication immediately the baby is born to prevent the baby from having it. So it's so important that you don't miss any of this opportunity.
Let's stay on HIV for a minute before we go on to the 5th and the 6th point. Give us the differentiation between, we say HIV/AIDS. We join it as though it's one word. But can you just spell out the differences for us? I mean, both you and Doc can help us with this. Asamaba? Yeah.
Then should I?
Yeah. Okay. So first, before she mentioned the test, right? The test is based on viral load. That's the number of copies of the RNA virus of HIV in your blood. When we take a blood sample, how many of it is there present? So for it to be undetectable, it has to be between 20 to 50 CP per milliliter, right? Then you move to, so the more virus you have in your system, the more you go from being moderate to severe to acute. Do you understand what I'm saying? So it gets to a point where we say that your viral load is so high that if I do the test, it's detectable, or it's so high that now even a bit of your blood can infect somebody else. There's a point where viral load can be so low that even if I put your blood in somebody else, the person can get HIV. Do you understand?
Yeah.
So that's why these medications come in to help to suppress the virus to a certain point where it's negligible. That if I test right now, the person might not have. You see, the test will say negative, but you still have it, but in a low form. Now, for you to get to HIV, from HIV to get to AIDS, right? You need to have increased your viral load to a certain point. So somebody can have HIV from the first week to about 10 years, where the person doesn't even show symptoms. That's someone who doesn't know, has not tested, doesn't know. But the person is living their life, eating well, doesn't know. So the body is trying to fight it. The body is covering up for it. So once in a while, you hear these symptoms that come in and go. We treat with medication, goes away, and then you are cool. But you don't test for HIV. For you to get to AIDS, it means that every system is shutting down. It's affecting everything. You're getting to the end stage. When you get to AIDS, there's no reversing back to HIV.
Right.
You get where I'm going with it.
Yeah.
You cross that threshold from HIV to AIDS, there's no coming back. It means the medications have stopped working. So right now we are sort of like, it's called palliative care. You're just managing your symptoms.
Till
You
you
treat
die.
certain pardon?
So till you die.
Till you die.
And HIV is only through sexual?
No.
Or the highest
no.
And the reason I'm asking that is because I know about the blade and all the infusions and all those things, but I'm asking because when we heard about the fact that blade and shavings and all these things, we were afraid to go to the barbering shop. That's why some people have got afro. You understand? So like this, I have afro. But I want to understand how long can the virus stay outside the body to be on, because those are the conversations that really sometimes scare people, that we hear that you go to the barbering shop, if they don't sterilize the blades and all those things, certain things can be transmitted, infections and all those things. But talking about AIDS, can it be really transmitted through these shared shaving devices? Is it possible?
Yes. One of the way of transmitting AIDS has been through needles, sharing of needles.
Okay,
People
needles.
Needles.
So the
drug
drug
addicts.
Okay.
Right. Another way she mentioned was between the mother and the child, through the either breastfeeding or through birth. The other way for us we call it occupational hazard. That's us. We are at high risk because we are exposed to everybody. We don't know your status, and then we go in with needles to try and take your blood sample. So we are also, that's our way of us getting it.
Okay, so hold on. So let's get a bit scientific here. So that small drop of blood, let's say in your field, small drop of blood just from a patient who is HIV positive or has AIDS, spills on your skin during work. Are you at risk?
Yes, you are at risk. You have to even report it. It's part of our procedures. You need to report it.
And
they put
you
your
start
medication. You start medication.
Okay, but that
They give you some time to stay at
Doesn't-
home so that you can take the medication.
doesn't that also depend on the person's viral load, like you just
Yeah,
explained?
we don't want to take that risk at that moment until those tests are ready, and no, we don't want to do that. So we start you.
Okay.
It's like a cover. We put you like you hearing bullets, and you are protecting a dignitary. You don't go looking at where the gunman is, right? You first protect the person, and then you try to find out where the problem
How
is.
about in cases where you already know the person's status?
No,
So maybe you probably know that the person has HIV, but it's low. It's very low. and then you still need to
yes,
check.
there's no
Good. So okay, so we've spoken about blood, but what about saliva? I cough, I use a spoon, I share, stuff like that. Can that also in any way transmit?
Yeah, so I'll give you some numbers, right? The survival time frame for the HIV virus to stay outside the body, right? If it's bodily fluids or blood, it takes about 7 to 10 days at room temperature.
Wow, 7 to 10 days.
Yes, at room temperature. right? If it's dried blood, it's dried. Let's say somebody cuts himself, the blood dries on the spoon or fork, whatever it is. 5 to 6 days.
Okay.
Right.
I mean,
Note this.
the fact that it's days is even scary. But
Yes. The needles and syringes up to 3 to 4 weeks.
3 to 4 weeks.
Needles and syringes.
Wow.
How about coitus?
I'm coming there. Even oral sex, mucous membrane, right, in your mouth. It's short-lived, but it's minutes to hours. Then we have surfaces like maybe on this table. That one's hours, minutes to hours too. Then it dies off. Now, HIV survives in very cold temperatures. Remember, viruses like cold. So 20 to 25 degrees Celsius is very optimum for a virus to survive. HIV survives in that. If the humidity is less than 50%, right, it reduces its survival rate.
Okay.
So the more humid it is, the more it survives.
Okay.
If you in direct sunlight, UV like from the sun, HIV doesn't like that. Yeah, it gets inactivated.
Okay.
In sunlight.
So it means that the prevalence of HIV/AIDS in colder countries
Probably
can
yes.
be high.
If it's exposed outside, it should be high.
Outside.
Yes.
Okay. So now let's talk about the. It's not.
So we can even just say that if you want to kill HIV, like you use something and you're not sure of it, you might want to increase the heat to 56 degrees Celsius and above. So the UV light that they use in the barbering machine, that's if the UV light is
Works.
at its radiation,
Okay.
it should kill the viruses. Right? So some people, being very circumspect, will say, even when he takes the machine, he wants him to spray it with alcohol.
Okay.
Because it denatures it and destroys it.
You see what midwife Ajo explained about having to do the test on the mother in the first trimester, and then the mother is okay, and then the second trimester probably has the virus, right? In those cases, how are you treating both the mother and the baby? And then in the cases where you do the test in the first and second trimesters and then you don't find anything, and then maybe just a few weeks into the third trimester when she's due, and then you find out that she has the virus, how do you go about that? Because at that point, the possibility that also is there a possibility that the child has been infected at that point?
We can't make any conclusions now, but immediately we realize the woman has tested positive for the HIV, we quickly put her on medications.
In the third.
Yes, immediately.
So let's be clear. While still pregnant.
While still pregnant,
Okay.
please. It doesn't.
You can take the medication.
baby.
It won't affect the baby.
No, it
Anyway.
doesn't. It doesn't.
Okay.
You can get pregnant if you are HIV positive. You can get pregnant. That's what I'm saying. If you're having disease conditions, you should treat them like diabetes. The other ones, hypertension.
So we reduce your viral load when you're preparing for pregnancy to a negligible amount. Then you can get pregnant. It's still on medication.
okay.
You'll
Yes.
be on medication.
But for how long does it stay reduced?
That's why it's a management.
Okay.
With constant management. That's why she mentioned that even parents, the mothers sometimes forget to give their child when they are born. It's constant management, which unfortunately people tend to play dilly-dally. They dilly-dally with it and think is okay if I don't take it. No.
Right.
Medications we give it specifically because we want a certain result, right? So as soon as you start messing around with it, when we'll see the results.
Okay. Please add up.
Most of the times, the people, it's not that they don't want to give. I've had people who are like, midwife, please hide the medicine for me. Like, remove the leaflet on it. Like,
I don't want to see some of the things we put inside.
Remove
Some
the
gum,
thing
some
on
gum
it
containers.
because
Change
they are
Stereotype.
yes, because of those stereotypes. Like, I've had people who are like, midwife, I have a neighbor who is a pharmacist. Will she be able to identify the bottle? Then I tell them, okay, I will do something for you. I get something to cover the wrap, the thing written on it. Then I do something to indicate how you would have to give the baby. She's like, anything we can do to help you to give your baby the medication, so in these instances I even involve the partners, because your partner could be is the only one that can support you in this. So your partner can tell your in-law or your mother that, oh, they say we should give this baby the medication every day, so that you can have your way to give the medication to the baby, because your mother-in-law maybe
will be wondering why.
They'll be wondering what is wrong with your baby. How come we are giving you? And you don't have to be all over the place to tell them you are HIV
positive.
positive.
Okay, let's move on from HIV into the 5th, 6th, possibly 7th pointers on how to. We'll come back to this on preparing yourself, because we are on the women. We have to come to the men as well and things we need to do. Very, very important. Yes, I have to help my brothers and my brothers out there. The brotherhood is for you. Brotherhood.
They are proud of you.
Yes, I speak for them. So we've mentioned mental preparedness. We've mentioned the frequency of sex. We've mentioned
Medication.
Medication, folic acid. We also spoke on the health conditions. Yeah. What are the other things that we need to look at, or women need to look at?
You should eat well.
Eat well.
Yes, eat well.
Are there any
Eating
particular
well-
things that?
Eating well
Really,
has a way of helping.
4.
Banku 4 give 4 children.
Banku for the Ellen is ready.
Please, if you are watching us,
Banku for tilapia. Banku for
please, I say, I
tilapia
have
one.
moved
Tilapia
them.
one, Friday one.
No, please,
you
I
have-
say,
if you
I
have
have
triplets.
moved them. Okay. No Allah.
Are there any particular meals? We've had pineapple cleaning up the, the womanhood. Is that true? And all those things.
The
Is it
what?
fact? I'm saying that they say pineapples clean up the.
you can't say it.
Yes, it's a difficult word. It's a very big English word. Sometimes it's very small, but
I
it's
believe
very.
in you.
The
Reproductive organ.
yes, the reproductive organ. Let me just say thank you very much. Thank you very much. Yes, I was not built for that. Yeah, all these things. So what exactly are they eating, or is just regular dieting, good dieting?
Yes, good dieting. Like reduce the fatty foods, reduce the sugary foods. Just eat well. We know that eat well, more leafy vegetables, foods that have more fiber. Like the
No
portion,
smoking.
don't eat too much. Like people eat and just eat well. Make sure that you are checking your weight. I think I did a video on how your weight affects your fertility. I did a video on how your age can affect your fertility. People came at me, like especially on TikTok. People came at me and they were like, "How old are you? You are a young girl. Like, do you have a child?" And please, these are real issues. It's because I genuinely care about you. That's why I'm telling you these things, because they have a way of affecting your fertility.
Right.
So the other thing is you should drink enough water, because when you're drinking enough water, it helps in as much as it's regulating your body temperature. It also helps your blood, because a percentage of our blood is water. So it's so important you drink a lot of water.
Yeah.
Then the next thing is your lifestyle. Reduce caffeine intake, stop smoking, like exercise. It would help you. Like
Yes. Let's talk about the periods, the safe and the unsafe periods and all of that. When is how does that calendar work? This is very important for young men out there. When I ask, then I get some look. Then I see. Oh, I'm only asking on behalf. I'm a very trained.
Reproductive health advocate.
Advocate. Thank you very much.
Continue providing the words for him.
Yes, I'm RPA.
Okay. What's RPA?
reproductive
RHA.
health.
It's RHA. Reproductive
No,
health.
I don't want
healthy?
the H to come in. Take it easy.
How can you tell me
Banku for.
the story?
If Gobe can make you pregnant,
Two
then
slightly cute kinky.
this week, if Gobe can make you pregnant this week, the Lenny and I, the man, they were kind baby. So, but anyway, okay, you were saying so about
One cute
how
kinky.
does a woman calculate that safe period and unsafe period moments and the best time to hit hard?
Everyone is unique. We have different cycle length. The first thing you need to know is your cycle length. Your cycle length is the number of days that are between your periods. It's not the 3 days, it's not the 4 days, it's not the 5 days that you menstruate. It's the number of days that are in between your periods. So assuming you
So when it
menstruate,
starts to the next when it starts.
Yes, to the day before it starts, because you are starting
Okay,
from the
okay.
next one, it starts again.
Yes.
So averagely, most women have about 28 day cycles.
Okay.
But some people have irregular cycles. That's where the challenge is.
Comes in, yeah.
Because if you don't have a regular cycle, you can't be able to track your ovulation.
Okay.
That's why the regular and protected sex is very important. You
Okay.
don't just limit it to your ovulation period. Okay, so for someone that has a typical 28 day cycle, the person is likely to ovulate on the 14th day. Please don't
Doc,
take me out of context. I'm saying
Yes,
I'm using a lot of likely because these are not things we are very certain.
It's an individual.
Yes. Doc, we want to learn it. So let's take 1st November to 28th November.
Okay.
Just to paint a graphic picture. Lenny, just to paint a graphic picture so that people can actually understand. Yeah. So let's say 1st November to 28th.
It will be 29th because we are.
Sorry,
counting
29th
it.
November.
Yes,
So likeliness, you're saying that on which dates is the person going to start? This will be the
likely to be your ovulation period is likely. Okay, so the ovulation
Assumptions.
day is likely to be the 14th day. However, the ovulation period can start from the 13th to about the 15th or the 16th day.
Okay.
Don't forget, last week we said that when the egg is released, it's fertile or potent for about 24 hours. And you don't know when it will be released. So you just have to make allowances for those days.
So let's say 12th to 17th.
Maybe
Let's just
people
say
say a
assumption.
week.
A week,
Let's
yes.
just give that as
Yes.
Your
a
buffer.
ovulation
Yeah.
period. Yes. So that is that for the ovulation period.
What happens during this ovulation period?
During your ovulation period, an ovum is released from your fallopian tubes. Actually, it's the fallopian tube that, like, the ovum is connected to that place. So I wish I had pictures to show
It's
them.
fine.
Would have
Yeah,
made it
yeah.
easier. It's released, so it comes out. It comes into your uterus, passes through the fallopian tubes, trying to see if there will be any semen it would meet.
Okay.
So when you have sex, lots of the semen quickly rush into the uterus, which they don't have permission to go into always, because it is only during your ovulation period that your cervix opens slightly, so
Okay.
that the sperms can find their way there.
So during
It's only
a period
during-
that is you're not ovulating, it's closed.
Yes, that's
okay, I think
why
we can have
when
a
you have
diagram on the
sex,
screen now.
the semen pours out.
And you won't get pregnant.
Yes.
Okay, you're likely. Hey, please, likely.
You are
not,
likely not
to,
to.
You are
not
likely
to get
not
pregnant.
to get
So
pregnant.
that okay. So that's what happens during that ovulation.
Yes, please. During-
Period for women. How do contraceptive pills, emergency contraceptive pills, work within this period if a woman doesn't want to get pregnant?
Emergency contraceptive.
What do they do? Do they go and kill the semen, or do they go and destroy the egg, or do they?
Okay, I'll use maybe an analogy people will understand easier. So during a period of your menstrual cycle, right? If we release sperm into your vagina, into your cervix, the fertilization won't
Okay,
okay.
if you say we, then it's like somebody does on training.
Yeah, either in IVF or through your partner or whatever it is, as a test process, you won't get pregnant because a mucous membrane is created as a barrier
Okay.
that prevents sperm from going through. So it's like a cement wall, a brick
Okay,
wall. Nothing is going through.
Okay.
Right now, this membrane, so ovulation is getting near, and you are ready to. It starts to soften, and now your sperm has a certain material on the tip of the head. It looks like a tadpole, but at the tip of the head, that is able to break down through that barrier, and then continue its way to fertilize to meet the egg, and then fertilization occurs. These medications were designed to mimic and harden that wall.
Okay.
Do you understand? So these medications go and strengthen that wall and prevent any sperm from going through.
Okay. Okay.
Or some are called spermicides. They kill sperms.
Okay.
In the form of an IUD, the copper material produces an environment that is toxic to both sperm and ovum to fertilize, to prevent them from meeting, and then it destroys everything there.
Okay.
I'm giving three parameters where
Yeah,
these things are
yeah.
happening. Now, there's been this school of thought that the more, because your body naturally produces this wall and prevents pregnancy, the more you take these emergency contraceptive pills, your body starts to adapt. It starts to mimic itself without the medication. It starts to think that, okay, you don't want to get pregnant, so we're going to keep creating the wall. So that's why she mentioned that in preparing for pregnancy,
Trump.
in preparing for pregnancy, you need to tell your healthcare attendee that this is what I want to do. I want to get pregnant, and this medication is what I was taking before. So they'll start to wean you off some of them. They'll do certain tests to start to wean you off and prepare you for pregnancy.
Okay, now that said, is it possible?
The way you are stretching your finger to ask, it's like you have something really on your mind. I mean,
Please go ahead.
Go ahead. Just go ahead now, please.
One cute kinky.
Our time is almost
Is it
up.
possible to just get off the contraceptives and the pills and then start with the folic acid as well? Or you have to wait it out for a while, let that clear out of your system, and then you can start with your folic acid?
Yes and no. in a sense,
Say it loud so that everybody hear.
I didn't say anything.
so in a sense that you've been on the medication for a long time, it means you are taking to a point where you are abusing the drug, because the word says emergency. In the process of which you were not sure and you took it, people are taking it like it's as if it's a family planning. It's not. It's not family planning. People should know the difference. It's not family planning. Not for family planning. Even in certain situations in family planning, when you miss some of your medication, we tell you to take emergency contraceptive as a daily thing once, not a daily dose that you take. Right?
Yeah.
That's besides the point. So this medication in your system, in order for you to wean them off, you can start your folic acid, no problem. But understand that you can't go back on this medication.
Okay.
Because medications leaving your system depends on how your system is. It could take 2 days, 3 days. For somebody, just 1 day. Everybody, and as you say, hormones control everything.
Please, our time is up, but I'll just beg for a few 5 minutes to ask these questions. So how long does it take the sperm to, after the person has had unprotected sex, with the intention of getting pregnant, and today was the 13th of November, and the person is likely to start the ovulation process. How long does the sperm take to get to the egg to fertilize? Or there are no scientific calculations to that per se, or that might be difficult to test. So everybody is different.
I'll be sure I'm saying the right thing.
Yeah.
Okay. So let me give you some parameters then. So ejaculation, we start from ejaculation, right? Ejaculation is when sperm is released into the female reproductive tract, which is the vagina, cervix, right? That's, let's say, you said what day did you give?
Yeah, so let's say 13.
13. So ovulation, the egg has been released, right? So 13th. Okay. For it to penetrate the mucous membrane, it takes about 5 to 30 minutes.
Wow, that is rather very quick.
Yes.
We are in the lead.
So the stronger sperms, probably 5 minutes, they are done, they are gone, right? And some will be there knocking on the door.
So then, how does the pill then work if it's taken 24 to 30? That's the
I'll explain that.
Yeah.
I'll explain that. So the next part is for it to enter the uterus and uterine tube, that's 30 to an hour. Then fertilization occurs in 5 to 24 hours.
Okay.
So between intercourse, an average of 12 to 18 hours, you will have fertilized the egg. And then implantation, for the egg, the fertilizer to move and come and implant your womb for pregnancy to begin, is 6 to 10 days after fertilization.
Okay.
6 to 10 days after fertilization, which happened 5 to 24 hours.
Okay.
So in total, it's about 11 days, give or take. Now, the reason why these medications, they tell you that within a window of about 3 days, you should have taken it. And it's more, they write it there. People don't read it. Efficiency reduces as the days go by. So the earlier you take it, the better it works. But people think, because they said 3 days, I can take mine the third day. And then it doesn't work. Because efficiency has reduced.
And at that point,
At that time, chairman has. At that time, we are arranging chairs for outdoor. We put up canopy. Right? So, though we are using timelines, now the mucous membrane forming, right? Another thing the drug also does is prevent fertilization.
Okay.
So that 24 hours is going to prevent the two of them from fertilizing.
Okay.
Right? It's just not just forming the wall, it goes after the sperm.
Okay.
It's going to prevent you from, it's not going to happen. This marriage is not going to happen.
Okay.
In the case that you delay and all these things happen, just know that we'll see you in 9 months.
There are a few myths, and we are wrapping up, but please, there are a few myths around that if you want male or female, you want a boy or a girl, and positions. Is that true?
You have a child, so you can explain. You are married and you have a child, so you can explain. You are married and you have a child. You are married and you have a child.
thank you for sending me out.
I see.
The two of you.
That's why.
That's why.
The two of you should explain this.
They change position.
No, I've seen something. I've seen the light. Yes. But
So can you explain?
from a medical practitioner's point of
It's
view,
not true.
That's the XX or the X.
Yeah.
can any position
Okay,
harm?
so let's say this before we leave here, right?
Yes.
Please, to anybody listening to us, let's put this out there. The man, the male genome is what determines the sex of a child.
Yes.
A woman is basically an ovum. Whatever you give her, she will add what? An X.
And female is.
If you give her Y, she will add an X. It becomes a male. If you give her an X, she will add an X. It becomes a female. That's how it works. We carry the X and Y genome. We change the outcome. So that whole thing was one mommy bear. Please, we want to Please stop.
Ignorance.
It's ignorant. The woman. It's not your fault.
It's
the man. It's the man who decides what comes out. You've done your job,
man
please.
Then decide the gender by either any habits or anything, or it is lotto.
It's a lottery system.
lottery.
It's purely lottery system.
Okay.
Whichever sperm wins. It's a race. A lot of them are, if you sit on this one, they're all released and everybody runs. So you see, you're a winner from birth. For millions of people, so I feel like in life you should just use that as your example that I can achieve anything.
But this question about the sorry about this most of the time. This myth. One of our producers, his name is Fake. Fake has been asking this question in my ears. He's been asking the producer to ask me about he believes strongly that the
certain
positions can actually be able to
positions.
yes.
I have not
so.
heard. I've
It's
heard
a
this.
it's there.
Yeah, I've also heard it. I've heard
An old wives'
I've heard
tale.
about
It's an old
the
wives' tale.
Chinese calendar, some calendars
Yes,
want a boy.
Really?
There's
People
a
have
timing
used it
and
and
all
it
of
has
that.
worked for
I
them.
mean, also maybe it's just that's what they are supposed to get, and then they've done that position 10 times and gotten 10 girls, so they think that is the position that works. I mean, what's the
Until they
chance
put us, they give
that
us
that's
numbers and proof. Unless some of us were
Exactly.
there to observe the whole process.
The
I'm
final
not
question,
doing that.
I just pushed for 10:05. The final question to ask is, immediately after
Coitus.
sexual intercourse or coitus, the semen that allegedly goes to commits its crime. Is there anything that the woman must do immediately after sex? Immediately after sex, must you wait in the position that you are in? Must you,
Your turn.
your back
those
and raise your
things?
legs.
Must you
People
lie
under
back and raise your leg?
Yeah.
Tie your leg in the S mode.
So there are issues
So
with
these
that.
are these are some of the myths around.
Some
It's
people
true.
have
I've
some
heard
people have
people say
certain
it's
some people have certain
erotic.
conditions in fertility that prevent sperm from staying in the cavity.
Mm.
So when they get up, it's sort of like it doesn't travel. So those people are sometimes
Is that what
advised.
they call weak pelvic floor?
Yes. So those people are advised to stay in certain positions and allow time for all this to work. That's different. Everybody is different. Some people are there. Your womb is so secure that
That's why they do Kegels. That's what it's called.
Yeah,
Kegel exercise and all that. And even with some pregnancies, we actually have to go in and tie the cervix because the
Yes.
child will descend. The whole pregnancy will come out. So we have to go and close the door.
There's a name for it.
Cerclage.
Cerclage.
Okay.
It's a cerclage. So we go in there, we suture it, and we close it up until the child is about to deliver. Then we go in and reopen.
So sometimes you have to some women would have to stay in a certain position
Yes.
to allow it there for a while before. Oh, you see.
That's just sometimes.
Sometimes it's not for
people,
everyone.
not
Yeah.
everyone.
So
Not
once
But the whole thing is about
Everyone.
the whole thing is about ovulation. The whole process of this ovulation. If she doesn't release the egg, if she doesn't release, what happens?
Egg quality. Some
Yes.
people it's egg quality and sperm quality.
Nelly is also asking. She's producer. Is also asking that. So with sex, where the semen is outside. Somebody say it's not me asking. No, it's Nelly. I'm listening to my ears. People see this and this. Where the semen is put outside the
Vaginal
vagina.
orifice.
Yes, orifice outside. Can that lead to pregnancy? in
Yes,
any
it
way?
can. We've had a case where when you open the ladies, when she did a pelvis examination, she was still her husband was intact. She was still a virgin.
Hymen.
Her hymen was intact.
Wow.
The gentleman in question released onto her labia, her clitoral area, so outside basically.
And,
And we mentioned that
pack tables already.
we mentioned that the vaginal fluid is also coming out during intercourse, right? This whole process is getting wet and all that. So vaginal fluid is also a pathway; it can travel. Sperm just needs a medium. It's already in its own medium already, and you give another medium to travel. So it went through because the hymen is not a sealed. It's not like a sealed. There are spaces around it. Sperm is not that big. It's really, really, really tiny, right? So it went through, and the lady got pregnant. When you check, my daughter is she is a virgin, but pregnancy is okay.
This one.
Sheesh.
She will kiss her
You
stuff.
go explain tire.
We have to ask Joseph.
Well, interesting, but thank you so much. I wish we could push on, but I'm tempted for us to have another third part conversation about this on the men's side and the men's habits and things that men need to do. We've heard of low sperm count, we've heard of all these things. So, but I think we'll push for a third conversation, but we'll fix a date on that one and let our viewers in on that, because the brothers need to
They need help.
Yes, the your brothers need help. But for the women, I think it's quite a clear conversation to understand what to do, if you intend to get pregnant. However, if you don't intend to get pregnant as well, you know what to stay away from in total. Spare the rod and spoil the child. I wish you understood what that meant, but Lenny, your birthday wish, yes.
Yes, birthday wish. Happy birthday going out to Tracy, Maria, Dikadi, Nelson. Have a good one, my sister, and enjoy your day.
Well, enjoyment. Enjoyment is the key word she's looking out for. On that note, our time is up. We're out of here. Thank you so much for being our guest this morning on the show. And to you as well, viewers, thank you so much for being here. Culture Daily, we're back here tomorrow and we out.
Culture Daily was brought to you by Telecel.